Hi, I'm Dr. Shiva Challa, an orthopedic surgeon.
Hello, I'm Dr. Deepti Challa and I'm a rheumatologist. Together, our channel is A Couple of Joints.
I just wanted to ask you a very important question because right now the weather is getting really cold, and my question to you would be, why exactly are my joints kind of hurting when I wake up in the morning? Is it normal, or am I getting too scared of something?
So, as you know, Shiva, all our joints have a synovial fluid and a synovial membrane. So the synovial fluid has a tendency to gel in cold weathers, and it also has a tendency to gel at rest. So in winters our movements are quite less and the weather is quite cold. So in such cold weather, our synovial fluid tends to gel a little more than normal, and this gelling causes significant stiffness of the joints. So probably it is this joint stiffness that you're perceiving as joint pains. So tell me one thing, Shiva, are your joint pains coming with joint swellings?
Luckily for me, no. No.
Then don't have to worry about it. Joint pains and joint stiffness tends to be on the higher side in winters. But as long as you don't have any joint swellings or your pain is not unbearable, nothing to worry about.
Okay. So, see, summers, we all drink lots of water. I've always, not even science backs me in the fact that the more you move your joint, the more healthy it becomes. So, is it a reason that we are getting more lazy and we tend to wake up late in winters and also exercise less in winters, that it plays a role in causing joint pains?
Firstly, in winters we don't feel as thirsty because the weather is much cooler, and it is a misconception that when you drink more water you tend to visit the toilet more often. So this leads us to drinking much less quantities of water than what is good for us. So this leads to dehydration, and dehydration can trigger inflammation. And in patients who have gout, that is high levels of uric acid, this can trigger an inflammatory process of more uric acid, which goes on to cause worsening of joint pains. So yes, dehydration is a known factor which contributes towards joint pains in winter. And yes, Shiva, you rightly said that because of less movement, due to various reasons, either the cold weather is not letting us get out of bed early or it is just making us feel lazy, we tend to move a lot less and we tend to be restricted with our movements because the weather outside is not very conducive to exercises. So this also leads to joint pains and joint swellings. So my tip for winter joint care would be drink a lot of water, and I tell my patients, move it.
Since you said move it, all I remember is the slightly obese patients are actually moving it a lot in winters because they want to lose weight in these 2-3 months and then maybe get their joints replaced. And the other choice they have got is actually visit on a pilgrimage, and they're going to Varanasi. What exactly happens once they actually travel in winters and they actually do this stressful fasting that they do in this holy month of Kartika Masam, as we call it in the south?
So when normal individuals go on these pilgrimages or fasting, or they go to visit these sites or take a dip in the holy Ganges, nothing much happens, probably a little stress related joint pains. But I'll tell you what happens to my patients. Number one, all these pilgrimage sites, as you've mentioned, Ayodhya, Varanasi, Vrindavan, they're all situated in the north of the country. Compared to Hyderabad, the north is colder, the north is drier, and this already leads to more joint pains and synovial gelling in my patients. Number two, all these pilgrimages involve a lot of sightseeing, a lot of temple visits, a lot of pujas and rituals. So this adds to a lot of physical and mental stress. And this physical mental stress is also associated with the cold weather can trigger an inflammatory joint pain. So these pilgrimages are not really advised for my patients, that is patients who have inflammatory arthritis, unless their symptoms are under control. But even patients whose symptoms are under control can get triggered due to these pilgrimages. So it is better to avoid these pilgrimages in these winter months, or to have a pilgrimage which does not have a lot of stressful journeys and rituals.
So that's an important point as well. And one of my friend who's in his mid-30s, and what exactly happened to him is he wanted to watch an India match in Delhi, and he went to Firozshah Kotla. The match had to start early because there is a lot of smog happening and he had to cover his face, and he had a lot of issues with the whole match surroundings. Do you think smoke around, or say the pollution around us, is actually going to trigger anything related to inflammatory arthritis?
Yes, in colder areas, as you mentioned Delhi is much colder, and Delhi is also having a problem with smog. So what is smog? So when you have a cold fog associated with a lot of pollution because of crop burning and a lot of vehicular traffic, which Delhi has. So we have an entity called smog, that is smoke with fog. Pollution is a known trigger for arthritis. So patients who go from a non-polluted area to a polluted area can develop new onset joint pains, or patients who already have joint pains can find that their joint pains are much worse in polluted areas, especially when they encounter smog. Also, another thing you need to note, smog and fog increase the chances of other respiratory infections, like you have a more chance of catching a cold or an asthma, and these infections by themselves trigger arthritis. So yes, cold weather, polluted weather contribute towards increased smog and contribute towards increased infections, especially respiratory tract infections, and all these are known triggers for arthritis.
Okay, when I keep it in Hyderabad's perspective, are you saying people in high-tech city are actually going to have more arthritis and people in the older city are slightly safer when you compare the pollution levels?
I don't want to get into any controversies here.
Okay, there's no, that's, yeah, maybe we'll leave it for another day, but that's a very important information regarding pollution. If you have a patient who actually has rheumatoid arthritis, she has been exposed to, like my friend who's gone to the match, and they got exposed to that pollution there. Is there anything that they can do when they're already diagnosed and they know that they're going to get exposed to pollution on a day-to-day basis?
So the first thing I would tell my patients who are traveling or who are going to a colder area is to mask up. Mask up because the mask can protect you from pollution, respiratory tract infections, and can also protect you from the cold weather because the mask keeps your nose and mouth area humid. Number two, avoid places where there is excessive crowd. So avoid visiting crowded temples or visit temples when the crowd is quite less, and avoid places where there is large human gathering. So when you take these precautions, you should be fine.
Are we back to the COVID era then?
We are not back to the COVID era, but it is sensible to always use a mask in polluted and infected areas.
Especially for the rheumatoid patients, it's not for the general population. And yeah, also, being in the, even for the general population, obviously pollution is never good for your health. So should I take it as a personal jibe that are you asking me to fast, or you are asking me to actually go on a pilgrimage?
No, I'm not asking you to fast, nor am I asking you to go to a pilgrimage, but honestly I think you could do with a little fast.
That's I mean, for the personal talk we'll leave it for a later date, but is there any other advice you want to give to our patients who are actually suffering with inflammatory arthritis and who are out there suffering because of this cold weather?
So the first thing I would suggest people is to use a mask and avoid cold areas. Second would be to keep yourself warm. Keep yourself warm by woolen clothing, wearing appropriate gloves, hat or socks. Avoid prolonged sitting in air-conditioned environments because again air conditioning can trigger your joint pains, and a closed environment such as an air-conditioned environment. So one person has cold, that can lead to the rest of them also catching cold. So avoid air conditioning, avoid cold areas, keep yourself warm. Keep yourself hydrated, that is the most important, and always stretch your joints, stretch your body before you embark on an exercise. Because of the cold weather, your muscles and your joints are already stiff, so a little stretching would ease the joints before you go on to a full-fledged workout. And as we know, when you don't stretch well, you might injure a joint, and I think that comes more into your forte.
So what I always love telling my patients is a joint feeds on your movement. It's a very simple funda in life, and it's a very simple motto to everyone who's watching this. Just keep yourself mobile or give it as much movement as you can. Just don't blame your job, don't blame your personal life, do not bother about yourself. If you don't have 1 hour for yourself per day, then you're doing something wrong in life. So especially for your joints, I'm not going to talk about the rest of the systems, but it's only the joints which are actually my forte. So I'm going to say, you want your joints to be healthy, just make sure that you're at least keeping 1 hour of your life, especially for your joints, because mobility gives you longevity. It's as simple as that. With that, I would like to say thank you to Dr. Deepti for pollution related talks and enlightening me at the same time, and hopefully you too. Thank you.